The diversity of autism spectrum disorder, or ASD, can make it difficult to correctly diagnose. Sometimes autistic children are mistakenly diagnosed with a different disorder, like ADHD, or are told that nothing is wrong. Other times, kids are diagnosed as autistic when they actually aren't. That's why it's important for parents to know what the components of an autism diagnosis should be. What kinds of information should a clinician who's evaluating your child be considering? How can you know whether your clinician is following best practices in doing an autism assessment? Here are some tips that parents can use to make sure that their child is getting a thorough autism assessment. First, autism evaluation. Autism evaluations usually start with a screening questionnaire. There are a variety of screeners that pediatricians or other practitioners might employ as a first step to learning if a child might have autism before beginning a formal evaluation. Some are questionnaires that parents fill out, and others are assessments done by clinicians. The Modified Checklist for Autism in Toddlers, or MCHAT, is one questionnaire that is used to identify red flags. The MCHAT asks questions about behaviors that might indicate autism, but the test purposefully casts a very broad net, so it often flags children who may or may not be autistic. Similar scales include the Childhood Autism Rating Scale and the Ages and Stages questionnaire, which is more of a basic developmental screener. The Screening Tool for Autism in Toddlers and Young Children, or STAT, is another screener that probes for autism symptom behaviors in more detail than the other screeners mentioned. But it is still intended to be used as a tool to catch children who are candidates for further evaluation. If the questionnaire indicates that a child might have autism, then it's time for a more in-depth evaluation. A child should never get a diagnosis based on just the questionnaire. Next, we'll look at diagnostic instruments. If a screener indicates that a child may have autism spectrum disorder, the child should receive a comprehensive evaluation from someone trained in diagnosing autism. This evaluation will often begin with a diagnostic instrument such as the Autism Diagnostic Observation Schedule, or the ADOS-2. The ADOS is a test with different modules to accommodate a range of children. There's a version for toddlers that is play-based. For kids older than 30 months, there are modules that include more conversation according to the child's language level. This isn't the kind of test where there are right answers. The purpose of the ADOS is to evaluate the social skills and repetitive behaviors the child displays during the test. This means the evaluator is paying attention to things like if the child asks for help when they need it, gives other people a chance to speak, and follows along with changes of subject. The Communication and Symbolic Behavior Scales, or CSBS, is another good diagnostic instrument for toddlers and young children. This play-based instrument is also backed by research, but is used less than the ADOS, which covers a broader age range. Problems with interpretation. Even with these tools, it is important to be working with a mental health professional who has experience diagnosing people on the autism spectrum. For example, a person who has real expertise will be able to distinguish if a child has poor eye contact because the child is shy versus if there's poor eye contact in the way we expect to see in an autism spectrum disorder. A recent study, which we'll link to below, underscores the difficulty in distinguishing between autism and other disorders like ADHD using even gold standard tools like the ADOS. Looking at school-age kids with high verbal functioning, the study found that 21% of children with ADHD, but not autism, met diagnostic criteria for autism when given the ADOS. It's important to consider the motivation for the behavior. A child with ADHD might avoid an adult's gaze because they think they've done something wrong, rather than because of a social deficit. Or a child's face might be unexpressive because they're bored or distracted, not because they're less expressive in general. Interviews. Screeners and diagnostic tools are ways of gathering information, but they have to be considered in the context of other information from a range of adults who know the child. A full evaluation should also include a thorough interview with the child's parents that covers general development and current concerns. The interview will also closely investigate ASD-related symptoms. To gather more information, parents might be asked to fill out special questionnaires as well. The Autism Diagnostic Interview Revised, or ADIR, is one such interview, and is often paired with the ADOS. However, the ADIR takes 2 hours to provide, making it difficult to use in clinical assessments. An interview based on the ADIR or a parent checklist, such as the social communication questionnaire, can also be effective if it is led by a clinician trained in diagnosing autism. It's important to include early developmental information during the interview because there are many circumstances where symptoms are more obvious earlier, say at around 4 years of age, but diminish as the child grows. If you aren't attending to that early development and you have an 8 or 10-year-old, for example, you're going to risk really missing out. So having that information about early development can help the provider make a more accurate diagnosis. If the child is of school age, it is also helpful if the practitioner can speak to the child's teacher to get their point of view too. A school visit to observe the child would be absolutely ideal, albeit not always possible. A conversation with the teacher or having the teacher fill out a questionnaire will give the person doing the evaluation some insight into what the teacher is seeing firsthand at school, which may be different from what parents are seeing at home. Cognitive testing. An assessment should also include some amount of cognitive testing. One reason for this is that cognitive testing gives the person doing the assessment another chance to examine the child's behavior, but this time under different circumstances. The ADOS is a socially loaded test that is also less structured, which might be difficult for some kids. Some kids will do better during a more structured cognitive test when they are answering specific questions. Or maybe they'll get upset during the cognitive testing if they don't know the answer to a particular question, and they might have a tantrum. All of this information is helpful for the person doing the evaluation. The cognitive testing is also important because you want to learn more about how the child thinks. For example, you want to learn more about how the child organizes and plans or solves problems. Working with an autism specialist. Screeners are often given by pediatricians, but if there are red flags that indicate further evaluation would be appropriate, it is best to work with someone who has both experience and expertise in diagnosing children on the autism spectrum. It's best to work with someone who's seen hundreds of kids with all different stripes and knows what to look for. Academic and medical centers are often good places to find experienced diagnosticians. Parents can ask some questions to try to gauge a potential provider's experience. For example, what's your training and experience? Have you had specific training in assessment of people on the spectrum, and how much? What do you plan to do as part of this assessment? Will you be contacting my child's teacher or pediatrician? Try to find a practitioner who is able to answer your questions readily and makes you feel comfortable. A clinician who takes your concerns seriously and is experienced in assessing autism spectrum disorder is essential to getting an accurate diagnosis. For more information about autism spectrum disorder and other mental health and learning disorders, visit our Family Research Center at childmind.org. I'm Dr. Alana Telesford. I'm a licensed psychologist in the Autism Center at the Child Mind Institute.